Hey. My hospital is very large and employs a vertical structure with many horizontal branches. This is necessary within a large organization that provides many different types of healthcare services. I would consider my hospital to utilize a transdisciplinary model of care, and according to current research in regard to evidence-based practice, this is the best way to go about serving patients. Although this isn't always easy in a large facility with many human resources, it is the best model available. Also, my hospital has attained magnet status, so evidence-based practice is sort of the rule. From the self-assessment, my strengths came out as interpersonal and conceptual. It was no surprise that I didn't score high on the administrative part. Not really my forte. In regards to staff, the numbers that usually any kind of unit attains comes from higher up and is based on acuity. But an efficient nurse manager, I believe, can present a specific case to those higher levels of administration to show a need for certain resources, and that includes staff. For example, there's a large push today for hospitals to achieve magnet status, and research has shown that evidence-based practice is critical in achieving that. So the focus in evidence-based practice has been transdisciplinary for about 10 years or so. So that would actually kind of encourage higher levels of nursing administration to be on board with even different kinds of nurses. So incorporating departments such as psychology, social work, public health, and ensures the collaboration that the research regarding evidence-based practice dictates. And it also becomes necessary to incorporate different disciplines in nursing itself, like case management or mental health. As a nurse manager, I would need to work with higher levels of administration to gain necessary staff for my unit. I would also need to work with department heads from other divisions, such as respiratory therapy, occupational therapy, physical therapy, or speech and language pathology to help ensure adequate patient outcomes for the patients on my unit. I would prefer some combination of a vertical horizontal model in leadership, since there always needs to be a solitary voice that speaks for the totality of an organization. However, that one person, no matter how smart they are, they cannot possibly be an expert in every entity that is offered in a large organization like a hospital. That's where a more horizontal structure would be beneficial. The horizontal structure would also lead to a leadership model where there's more buy-in from employees and therefore more retention of the employees that organization trains, which is ultimately the best outcome for that organization. Thanks.